This is Robert, the registrar. How can I help you?
Hi, I try to transfer my patient. Is a 48 man, and she has she has a history of mild asthma from childhood, and in over now now he has a worsening the asthma signs, asthmatic symptoms, and associated with the chest pain. And in EKG, we found that ST elevation in anterior leads, and on examination.
Okay, so the patient has an MI.
Yes.
Okay, so what is it to do with childhood asthma?
Because associated with these symptoms, we can find bilateral wheeze and crackle on auscultation.
Okay, no, excuse me. If you call the emergency department and you say, I'm going to send you a patient, and they say, okay, what's wrong? What is the problem? Do you
Oh,
say he has had childhood asthma?
no.
What do you say?
Only it's better I see that the patient the patient had a sudden onset of crushing chest pain, and after that the EKG show us a ST elevation.
No, you don't need to say those now. When you call someone, when you want to introduce a patient, okay, suppose it's a morning report, okay?
Yeah.
In a morning report, you want to introduce a patient. What do you say? We have a 48-year-old man with sudden onset chest pain and possible MI.
Oh, yes.
You don't talk about childhood asthma here because asthma is not important.
Yes, I know. Yes. Yes, exactly.
Okay. Are we admitting the patient because of asthma or
No,
childhood asthma? No.
no, no.
So why are we admitting the patient?
For the MI,
Okay.
the recent MI.
So you're referring, so you have a patient, 40-year-old man, okay, uh, a 48-year-old man with sudden onset chest pain
Yeah.
and uh, possibly MI because of the ST elevation. Okay,
Yes.
right. Okay. Now this is what we want basically. What we do, the first thing we do is this. Okay, we go to the last entry. Okay,
Yes.
so now what is the essential information? Now tell me, what is the next thing you explain to the registrar? You start to say how it happened. Okay, tell me. Okay, could you tell me more how you found out he has MI?
Uh, the first thing I said that about the subjective, and now is about objective. Maybe on examination.
No. Just tell me the history of the presentation, okay? How the patient came to see you and how you found out it is possible MI.
The patient in the street transfer from a medical center. The first going to medical center, and after that transfer from medical center to me, my clinic.
Okay, so he went to medical center. When?
When after going to my clinic, I try to doing a set of investigations such as
Uh,
EKG.
Excuse me to interrupt you. Just tell me the story. When did he go to medical center?
Today.
Okay, so went to medical center today, and then how long ago was that? This patient has an MI. I want to know when he had MI.
Oh, don't mention in the case note.
Okay. So went to medical center today, then transferred to me. Okay. And when he arrived, what did he tell you?
In case note, there is no more information about this.
Doesn't it say when the pain started, how it started?
No.
Nothing. Okay.
Not, yeah.
Usually they say, okay. Now, so you have a patient now. He has sudden onset chest pain, and he has possibly MI. Went to medical center today, then transferred to me. Now we don't have any other history. No. Okay. This is so. Does he talk to you? Is he saying anything? We don't know.
No. In the case note, don't say about more this.
Okay. He was passing by a medical center and complained of sudden onset crushing chest pain on background of URTI and worsening asthma since last what? Okay. Not relieved by anginin. Okay. So is this yeah, probably significant. ECG mild ST elevation in anterior leads. What is ST 120?
I don't know. It's maybe the ST segments.
Okay, I don't know. Lungs, moderate wheeze, mild bilateral crackles, SpO2 to 86% on air. Hearts, slight S3 sound positive. Okay.
And sorry, I don't know about the OA and RA. The abbreviation of OA and RA, I cannot find it.
These are not
important.
Yes, they are important, but these are not standard abbreviations. OA means on auscultation, okay?
Oh.
And this means on air, I think, or respiratory aid or air, I don't know. These are not what we normally use.
Yes.
And mild APO, we don't know what APO is. We don't usually use that. ED, yes, emergency department, and GTN, yes. So, basically, if we have any history, we say that. If not, then we just leave it. So he was passing by the medical center. It doesn't say anything about transfer. He was passing by.
Yes.
Okay.
I
So
think that passing maybe means of transfer.
No. Passing by. It was just passing next to the.
Oh.
Okay, passing by. Passing by medical center today, then so had crushing chest pain, had sudden onset crushing chest pain. Okay, and then on examination, you said that on examination he had what? Wheezing. And what else?
Crackle.
And crackles. Okay, and that chest pain that did not.
And S3 in auscultation.
Okay, that chest pain did not respond to anginin. Okay, on examination, wheezing and crackles, S3 positive. And
That's it.
okay, right. SpO2 is 86%. Is that significant?
Yes, significant, but
Okay,
I didn't
right. Okay. If you don't know the abbreviation, just write it. Okay.
Yes.
Okay. And then what did you do? And then ECG. Okay.
Yes.
ECG shows ST elevation
Yes.
in anterior leads.
Yes, exactly.
Okay. And then what did I do? My assessment.
I did O2 oxygen via repressor.
Assessment
Not
first.
repressor.
Assessment.
Assessment. No, that's
Yes.
no.
So with impression of anterior MI, what did we do?
O2 via non-repressor,
Okay.
not nitroglycerin, morphine, ipratropium, and furosemide.
Okay. And with impression of anterior MI, possibly in the background of asthma and URTI. Okay. So with this impression, he was started on O2. Now, how much it is, and then what?
And is total information. O2
This whole thing.
nitroglycerin.
Okay, and the rest. Okay. So now we go back and see. These are the essential information. Yep.
Yes.
Okay. And this is mild asthma. And this goes to okay. Offered ETOH. What is that?
I don't know.
Ethyl alcohol as ethanol.
Oh.
Okay. So these are the good to know information. Okay. Now, but it's not relevant to the MI. Do you agree?
Yes, completely.
So what is the date today?
Date today, I think that
1st of June
first.
2011. Okay.
Yes.
And this is 5th of May. So I've seen him 5th of May, but what was that for? Central chest pain. And he smokes this much under stress: serotype, salbutamol, and troponin normal. Okay, so he had some chest pain a month ago, but his troponin was negative. Okay, so there was no MI. And then again, I saw him 2 more times, once on 12th of May, once 26th of May. Okay, and on 12th of May, what did I do?
His chest pain and exertion is important, but about a runny nose or pharyngitis is not main problem. And the investigation is better to mention about the stress test and how to find this during this test.
Mm-hmm.
And I think that is better to say about the slide ischemic change or etc.
Okay, so the first time that he had chest pain was a month ago, okay?
Yes.
So I say no, a month ago attended with mild chest pain, troponin was negative, okay?
Yes.
And then came again, and was there anything else that had chest pain on exertion, okay?
Yes.
And then an exercise test
Show ischemic change.
showed ischemic heart disease, and he was started on in medications, okay? Agree?
Yes. And lab test shows that high level cholesterol.
Okay. Okay, so lab tests showed high cholesterol, and exercise test showed ischemic heart disease. So we started him on some medications, okay? Then these medicines started, okay? And now chest pain for the last week, still complains of frequent mild wheeze, often forgets to take serotype puffs because of ethanol consumption, okay? So, compliance with medications, alcohol dependence, okay? So these are now good to know information. So we say alcohol dependence, non-compliance with medications, okay?
And smoker.
And smoking, okay? What else?
There is no important for mentioning about the asthma and upper respiratory infection recently or UTI.
Yes, we say here he's got asthma since childhood, and he takes serotype but non-compliant, okay? And after all of these, okay, we say right. No allergies, nothing else?
No.
Okay, right. So now we have a picture. We have a better picture, and the paramedic transfer. So basically, we say paramedic transfer to emergency department. Okay. Now, okay. So what did I do here?
Um, I think that is a emergency refrigerator.
Yes.
And someone others maybe said that in the emergency referral letter is better starting with the chief complaint and the recently visited, and I don't know is a right way or not.
Okay. You see, if this case comes to me, I'm sitting in the surgery. The first thing I do after I know that he's got an MI, the first thing is I put oxygen for him. I put IV access. I give him um, a GTN patch. I give him uh, some morphine, maybe clopidogrel and uh, what is the other one? Atorvastatin,
Yeah.
80 milligrams of Lipitor. Um, okay, and if he's wheezing because he's got asthma, maybe I give him some nebulizer for apratropium. Okay, I don't want to make him too tachycardic with salbutamol. Okay,
Yeah.
and the next thing I do, I call the registrar in the emergency department and I say, look, I have a 48-year-old man with sudden onset chest pain, and the ECG shows he probably has an anterior MI, and I'm going to send him to you. Okay?
Yeah.
I said, all right. Could you tell me what the symptoms are? Because the registrars don't like patients. They say, tell me how you know that he's got an MI. I said, well, basically he was just passing by, and he had this severe crushing chest pain that didn't respond to angionin. I did an ECG. The examination showed wheezing, crackles, S3, and SpO2 was 86%. We did an ECG which shows ST elevation. Because he has had chest pain since a month ago, uh, but he is not compliant with medications. I think he hasn't had his medicines, and that's why he's got this MI. And okay, any background information? Yes. He has asthma and he's had upper respiratory infection. He's alcoholic. He drinks a lot of alcohol, or he's dependent on alcohol, and he smokes 20 cigarettes a day. Um, and basically, this is the background. Now, okay, what have you done for him? Well, I gave him oxygen and morphine, a GTM patch, nebulizer, and I have arranged for an ambulance to transfer by paramedic. Okay, what would you like me to do? Please admit him as an emergency, or please see him urgently because it is MI.
Yeah.
Okay?
Yes.
So that is how you introduce this patient. Now, the other information is irrelevant information.
Yeah. It's
Okay?
a new vision. Yeah, it's a new vision for me. Thank you so much.
So, let's read yours.
Horrible.
Okay. Dear Dr. Barnetta, I'm writing to refer Mr. Elvin, a 48-year-old what? Gentleman?
Mm-hmm.
Who has signs and symptoms suggestive of. Why do you write this?
It, it's
With
not.
possible anterior MI.
Mm-hmm.
Your further management would be highly appreciated. Okay. Didn't it say anywhere that it is an urgent referral?
In the case note, doesn't mention it.
But it says I'm sending him with a paramedic.
Oh, paramedic means that. Oh, I know.
I'm writing to urgently refer Mr. Elvin and your further management would be highly appreciated. Okay. Do we need to say this here?
I think that yes, it is important because we clarify our requesting.
Okay. Okay. Further management.
Okay.
Okay. Mr. Elvin has been smoking a packet daily and drinking 10 standard drinks. Okay. The 10 SD standard drinks for 5 days a week. We don't need 4. 5 days a week. Regarding his mild asthma, he's on steroid twice a day. He's on serotype, I think. Yeah.
Steroid, I think the mention is steroid. Maybe it's my. Yes, you are right. Steroid.
Okay. So he's on serotype. And we write serotype with capital letter because it is a trade name. Okay.
Yes.
Twice a day, 2 puffs twice a day. Okay. So basically, we say 2 puffs. So 2 puffs BD. Okay.
Oh.
And salbutamol PRN, 2 puffs PRN.
Oh, we can write PRN or BD.
Yes, the registrar understands.
Yeah.
Please note, not comma, note that.
Yeah.
Okay. He's under stress with his own business. Okay. Now you have called a registrar and you're telling him he smokes and he drinks and he has asthma, he takes serotype. So, okay, why are you telling me these?
As a medication he is on.
Are these essential?
Honestly, no.
Okay, so I take them off and I put them down here. Okay, because they're not essential. So Mr. Elvin first presented on 5th of the 5th. Now, the reader needs to go and say, okay, today is the 1st of June, that is 5th of the 5th, so that is how long ago?
1 month, nearly.
About a month ago. He reported a history of occasional mild pain in the center of chest, occasional mild central chest pain. Okay.
Oh yeah.
On exertion. Okay. His examination was unremarkable, with provisional diagnosis of ischemic heart disease, checking serum lipids, performing a stress test, and reduction of alcohol consumption were recommended. Okay. Okay. I think that at that visit, a troponin test was done and it was negative.
Yes. Yeah? Yes, I miss it.
Okay. Right. Now about this sentence, sometimes we have long checking serum lipids, performing a stress test, and reduction of alcohol consumption. Okay, you see, this is the subject.
Yes.
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 When the subject is too big, we don't use this structure because the reader needs to read until the end to understand what you mean. So he was recommended to, or you can say, uh, blood tests requested. Okay. Blood tests were requested. Okay. And then you can say blood tests including so actually serum lipids. Were requested. And it was recommended to reduce alcohol consumption. Not that I agree with this structure, but yeah, you could, in terms of grammar, I think when you have a big subject and your verb is here at the end, it's better to change the structure. Okay. On subsequent follow-up visits, he experienced worsening of the symptoms, including upper respiratory infection. Okay. Further, a set of investigations showed, further investigations showed high level of cholesterol and ischemic changes were noted. Okay. And ischemic changes were noted on exercise stress test. He was prescribed Lipitor, Imdur, aspirin, and anginin. Anginin PRN. Okay. And also the importance of using anti-asthma medications was emphasized. Okay. Right. Today, on the 1st of the 6th, do we need to say that?
I think that no.
Okay. Elvin transferred from a medical center with complaints of chest pain, so that is not true. With the complaints of sudden onset of crushing chest pain, sudden onset crushing chest pain. Okay, that's correct. With worsening of asthma. Despite taking anginin, pain was not relieved. Okay. And ECG showed the ST elevation in anterior leads. Okay. On examination, S3 sound was audible and bilateral wheezes and crackles were heard on auscultation. He was commenced on O2 via non-rebreather, nitroglycerin patch, GTN patch, morphine, ipratropium, and furosemide. Okay. Do we have his blood pressure?
No.
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 Mr. Elvin has been smoking a pack daily and drinking. Okay. Now, okay. Now, what do you think? I think now if I take this put it here, So basically, he's come with a possible anterior MI. He came with sudden onset chest pain, with worsening of asthma, and that didn't respond to angionin. Okay, and ECG showed ST elevation in anterior leads. On examination, S3 was audible, bilateral wheeze and crackles were heard. He was commenced on these. And please note that is upper respiratory important?
Upper respiratory infection is important, no?
Nope.
It's not important.
Nope.
For MI not, but for asthma, for additional treatment.
Okay. Right. Further investigation showed. Okay. Right. I take this off and see if it makes any difference. Okay. So when Mr. Elvin first presented about a month ago, he reported a history of occasional mild central chest pain on exertion. His examination was unremarkable. Further investigations showed high-level cholesterol and ischemic changes were noted on exercise stress test. He was prescribed Lipitor, Imdur, aspirin, and angionin, PRN. Okay, and that is not relevant. Now, right. Mr. Wynn has been smoking. No, smokes. Pack daily and drinks. 10 standard drinks 5 days a week. Regarding his mild asthma, he is on Seretide and salbutamol, with which he is not compliant. Okay. With which he is not compliant. Okay. And the stress, no. What else? Did he have anything else?
In the case note, no.
Okay.
Okay, I have a question. Has been smoking and drinking is wrong?
Because we want to use clinical and factual language, okay?
Yeah.
He has been smoking a pack daily and drinking 10 standard drinks 5 days a week. Since when? Okay? So you need to say since 2 years ago.
Yeah.
So when you use present perfect, then you need to say you are emphasizing on the duration.
Oh, yeah, I know.
Okay?
And it's a habitual.
Yeah. So this is what he normally does. He smokes a pack a day and 10 standard drinks.
Yes, I know. I know. And you share me the corrected letter.
Hello.
Yes,
Oh, sorry,
yes.
you were cut
I
off.
have sound. And I have a request that can you share the corrected letter with me?
Yes, of course.
Okay, thank you. Oh, it's amazing. It's amazing.
Okay. Right. So it came down to 195 words.
Oh.
Okay.
Yeah.
Okay. So, I mean, in view of the above, it would be appreciated if you could treat as you feel appreciate.
As you
Or
feel appropriate, no?
appropriate, okay. Should any queries arise, do not hesitate to contact me. Well, these are, again, meaningless, okay? So this doesn't have anything to do with the with the patient or with this letter, really. Um, so what we say, in view of the chest pain and ECG changes, I believe he has now developed developed an anterior MI, and it would be appreciated if you could see him or admit him as an emergency.
But don't mention in the case note requesting for admitting. Mention that it requests as further treatment.
Okay. Basically, treatment is you know, these tasks are prepared by maybe nurses or I don't know, but we usually say manage. We don't say treat. We say management. We don't send anyone for treatment. Okay.
Yeah.
Treatment is not the correct word. The correct word is management, assessment and management. Okay.
این قسمت فارسیشو میخوام فقط بگم، یعنی که من همش فکر میکردم اون حرفی رو که آخر نامه زدن اون خیلی مهمه، اون رو باید حفظش کنم، ولی لزومی پس نداره. یعنی اگه اون گفته the case note mentioned that is as treat, we can change to assessment and management.
That's correct. Basically, it doesn't matter what it writes in the case notes. What is important is you use appropriate language, which is factual and clinical. So clinically, treatment is not the right word. The right word is management. Management has a wider, what do we call it? Scope. It means to do tests, to give medications, to do x-rays, to do angiograms, to do whatever is necessary. So management is a bigger scope word, basically. That is the correct word to use here. You know, in different situations, we have a word which can be communicative. It can communicate what you're saying. So I would understand if you say treatment, but that is not the best word. The correct word is to manage.
Yeah. Yeah.
Okay.
Yes, thank you.
Right. Okay. So you see, you had some. If we want to score you, okay, let's see. I put a table here. 1, 2, 3, 4, 5, 6, and 7, and so we have let's do this. Okay, so the criteria is here, and the first one is purpose, the second one is content, and the third one is conciseness and clarity. The next one is genre and style, and organization and layout. And then the next one is language.
Yeah.
And the next one is our total. Right. So if you look at these, so what was, do we have the purpose? When you said that, you said the patient was referred. Go back to that task, number 8. Okay. Okay, you said I'm writing to refer Mr. Elvin, a 48-year-old who has signs and symptoms suggestive of anterior myocardial infarction associated with exacerbation of asthma after urinary tract infection. Your further management would be highly appreciated. Okay, is this a good purpose? No. First of all, we're sending for myocardial infarction. Do you mention urgent? No. And so you have extra information, which is exacerbation of asthma and urinary tract infection. So you just have written refer, which is acceptable, and anterior MI you mentioned. So we give you 1 mark here, okay, out of 3.
Yeah.
Content, okay, the content which is necessary. So here you said standard drinks, that's fine. He is on a steroid, he is on serotype, so it is not accurate. Under stress, okay. First presented reported of occasional mild pain, chest pain. Provisional diagnosis, serum lipids, stress test, reduction of alcohol, worsening of the symptoms, upper respiratory infections, set of investigation, high level of cholesterol, ischemic changes, and prescribe Lipitor, Imdur, aspirin, and angionin as needed, and also importance of using anti-asthma medications. Today, mild central complaints, sudden onset, crushing chest pain, worsening of asthma, angionin pain not relieved, ECG showed ST elevation on examination. This comments on O2, GTN patch, morphine, ipratropium, nebulizer, and furosemide. So you actually didn't say this is nebulizer and this is a patch. So you lose a mark here. In view of the above, it would be appreciated. Okay. Now, what are we missing here?
I think that O2 saturation is very important. I miss it.
Okay.
And
Non-compliance.
oh yes, non-compliance.
Okay.
I mentioned that about EKG changes, MR. Yes.
Okay.
Normal.
So you lose 4 marks for that. So you get 3 out of 7. Okay.
Oh.
Conciseness and clarity. Okay. Did you omit the extra or the unnecessary information? And if you did, if you didn't, did it actually interfere with fluency and with speed? And yep, it did, I think. You have a lot of unnecessary information. Yes. And it does interfere with understanding. So I would say probably 3 or 4 here, because you didn't actually summarize efficiently. And genre and style, okay. And the tone and the register is okay. I don't see any problem, okay. And with factual information, I would say that at times you haven't used factual information because he has been drinking, he has been smoking. That is not correct. Also, yeah, okay. So let's say we give you 5 out of 7. Okay.
Yeah.
I'm being very cruel. Don't worry.
No. It's great. Thank you so much.
Okay. Organizational layout. So I'm afraid you don't get much here. Your layout is a layout of a letter, which is okay. You get 1 point there. But the fact that you haven't actually highlighted key information and your organization is not logical, okay?
Yeah. Yes.
So I would probably say you just get 1 or 2 marks here.
Yeah.
Language. We had some mistakes, which was, yeah, you didn't write gentleman, I think. Signs and symptoms suggestive of anterior myocardial infarction. And, oh, that is very wordy, actually.
Yeah.
5 days a week, you need to put a space here, 2 puffs, you need to space here, and okay. Occasional is a spelling mistake. You repeated including here, and anti-asthma, lipids, extra space, anginine, GTN. Well, I think generally it's okay. It's your grammar, your vocabulary is not too bad. It is actually you use fairly good punctuation. Okay, except that you need to put 2 puffs PRN, 2 puffs twice a day. Okay, so the use of abbreviations is also not good. So in genre and style, you lost some marks there. So I would say I would probably give you 6 in your grammar in your language. So 1, 3, 3, 7, 12, 14, 20 out of 39. Okay. So if we go and say to the calculator, that's nearly 50%. Okay.
Yes.
So 20 divided by 39 equals 51%. Okay. So you have 51%, but to pass, you need 350 out of 500, which is 70%.
Oh, yeah.
Okay. So with 51%, it is 250. So that is C.
Yeah.
Okay. And to have a B, you need to score 70%. Okay.
Yeah.
So, yeah, not too bad.
But not too good.
Well, that's a good start. Your language is good, which is very good. So, yeah, that's fine. I've seen much worse than this. Okay. So, what we're going to do as a homework.
Yeah.
Okay. Study 5 case notes and write purpose and extract content. Okay. So we only want this. The content is the essential and good to know.